Hi, my name is Micah. I'm going to be doing your assessment today, your postpartum assessment. So I'm going to go on into her room and I'll provide privacy by closing the curtain. I'll ask the patient to verify her name and date of birth. Once I verify that with her bracelet, I'll go ahead and I'll wash my hands and put some gloves on. Um, so first I will lower the head of the bed to make sure that we have a good range to be able to assess her uterus. And I will raise the bed to a comfortable working position for myself to prevent any injuries to my own body. We will uncover the mother's breast, and I will ask her if she's breastfeeding or bottle feeding. If the mother states that she is breastfeeding, we're going to want to assess the nipples and areola to make sure that they're not dry and cracked. We can provide her with an ointment to help relieve that pain. We're also going to want to assess the breasts, their firmness, and we're going to see that they are soft and filling. If the mother is breastfeeding, we're going to want to educate that she has a supportive bra that she's wearing. And if she is bottle feeding, we are going to want to educate her to wear a tight sports bra. At this point, it's probably a good idea to go ahead and educate the bottle feeding mother that she will probably have some pain and discomfort, but the best thing to do is to not express any milk whatsoever, because this can lead to a production of more milk. We're going to want to ask the mom if she has been having any pain in her breast more than normal. We're going to want to educate her on making sure that she doesn't see any signs of localized redness, swelling, less output from one side, or more pain from one side than the other, because the mother could, once her milk comes in completely, she could develop mastitis, and we want to try to prevent that. And if those symptoms were to happen, which this mother is only 2 days postpartum, so her milk probably hasn't come in all the way yet. It usually comes in 72 to 96 hours after delivery. So then we're going to go on and we're going to assess her fundus. So this mother is 2 days postpartum. So we're going to support her uterus with our hand, and then we're going to palpate her fundus. We do find that her fundus, because she is 2 days postpartum, it should be about two finger lengths from the umbilicus, and we're going to go ahead and make sure that that's where it should be, which it is. It's in normal range. We're going to assess her. This mother had a C-section, so we're going to assess her C-section scar to look and see if there's any redness, more than normal of redness, swelling, discharge, anything that would indicate possible infections, or just overall irritation. We want to ask the mother if she's having more pain there than usual, and if so, then we can definitely follow up with that. While we're looking at her abdomen, we'll go ahead and we'll listen to her bowel sounds. We've already assessed her heart rate and breath sounds during our med-surg evaluation. So we're going to make sure that her bowel sounds are active, not hyper or hypoactive, and make sure that they are present and not absent. We want to ask the mom if she's had any type of abdominal pain, if she's had a bowel movement. If so, when was that? How long ago was that? And did she have any pain during her bowel movement? If the mother states that she's having constipation, or she's simply just scared of the pain of trying to have a bowel movement after delivery, most mothers are already on stool softeners, but if not, we can go ahead and start her if there are orders from the provider. After this, we'll palpate the bladder. We shouldn't be able to palpate the bladder, but we will attempt to, and we will ask when the last time was that the patient urinated, and if she says it was just recently, we can ask her if she's had any pain, burning, difficulty urinating. If she felt like she needed to urinate but couldn't, then we can follow up with that. So now we can go on down to the perineal area. We can assess the lochia. She should have a pad, and we want to make sure that's within normal range. So the mother should be laying on a pretty significantly large pad, and we want to make sure that she's had like a moderate amount of rubra. So that's going to be our bright red, and then we will also educate the mother at this point that as she goes farther along in her postpartum journey, that it should go from rubra to serosa, which is more of a pink color. It's a little lighter and not as heavy, and then it should eventually go to alba, which is very light, almost very scant amount of blood. We all want to also educate the mother that the stages of this should never regress back to, if she's at alba, she should never go back to serosa, or from serosa to rubra. It should only better rather than regress. So if the mother was to have an episiotomy, well, we would actually put her on her back side for this, but we can kind of rotate the mother to her side, and we can assess that area, and we can check and see if she has any sutures, how those are holding up. Make sure that there's no bruising, swelling. If there is, we need to make sure that we note it in her chart and follow up on that. So since we were down in the perineal area, we want to change glove, wash our hands first, and then change gloves, and then, or put on new gloves after we wash our hands. So we're going to go down to the lower extremities, and we're going to want to check and make sure that the patient doesn't have any localized redness, edema, any warm areas. This could signify some blood clots. We want to make sure the patient doesn't have any pain in certain parts of her legs, because once again, this could be a sign of blood clots. So we want to assess her popliteal pulse and make sure that that is strong, and make sure that there's no edema. I don't know if I said that. We want to check her post-tibialis pulses, and then we want to check her pedal pulses as well, to make sure that those are good. That way we know that if they're strong, there's some good blood flow going through there, to also rule out possible blood clots, because our mothers are at risk after having a baby, especially with a C-section, because they, for the most part, are staying in bed, especially if they're on medications like MAG or anything like that. So while we're on the back side, we could have also checked to see if this mother had a C-section, so she most likely had a spinal. We want to check that injection site. We want to make sure that where that catheter was placed, there is no drainage, no leaking, no bleeding, no redness, no swelling, no bruising. Same thing with the epidural site. We're going to want to check for the same things to make sure that there is no signs of infection, bleeding, anything like that going on. Overall assessment wise, that is pretty much everything, but we want to make sure that we do some teaching with the mother. She may be a new mom and she might need some education. We're going to want to make sure that the mother has a car seat on hand before discharge with our baby. If the mother does have one, we want to ask her if it is new. If it's not, we want to ask if it has ever been, or if it's expired, or if it's ever been in a vehicle that's been wrecked, because these car seats are made of plastic and they can deteriorate as time goes on. We want to make sure that the mother is aware of signs and symptoms to look for, such as a temperature of 100.4 and above. She wants to contact her provider for herself. And if her lochio, as mentioned before, was to regress and go from a scant amount back to rubra or anything, we want to know, or we want to notify the provider about that, because there could be some underlying issues there. We want to make sure, just as mentioned before with the breast, we want to make sure that if the patient is experiencing localized redness, swelling, or severe pain, that she is to go to the doctor, because she could once again have mastitis and will possibly develop flu-like symptoms. As for the baby's education, we want to make sure that the mother is aware that if the baby has a fever of 100.4 or above, that they need to call the pediatrician. If the patient baby rejects 2 consecutive feedings in a row, we need to also be notified. And if the baby isn't having as many diapers, wet or dirty diapers, as they should, so the baby should have 6 to 8 wet to dirty diapers a day. And if the baby is not having that, we need to make sure that we are notified. Other than that, we can ask the patient if they need anything. If she would like for us to bring her baby, we can help her get back up into a comfortable position, raise the head of the bed to wherever's comfortable. Make sure that we have bed rails at times too, call out within reach, and make sure that all of her safety measures are met. And if she needs anything from us, to tell her to let us know. And other than that, that's all. Thank you.